Hi, my name is Ivy. I am a bone marrow transplant nurse coordinator here at Emory Winship Cancer Institute. This video is intended for patients with multiple myeloma or a related plasma cell disorder who are receiving care here at Emory Winship and are considering a bone marrow transplant, also known as stem cell transplant. This video is for not only patients, but it's also for the caregivers. So the purpose of a stem cell transplant is to try to reduce and eliminate to the best ability any lingering cancer cells that you may still have in your bone marrow. So even though you may have already undergone treatment, there could be disease that is lingering. And so by going through a transplant process like this, the goal is to try to clear off anything that might be left over and to try to start over using fresh new stem cells that we collect from you with the purpose of creating a disease-free or as close to disease-free bone marrow as possible. This is a graphic that we will be using to orient you to the process. It will help you know where you are on this journey. At the beginning of a patient's journey, patients will come in for an initial visit, also known as a consult visit, where you will meet with the bone marrow transplant physician. You may have already had this visit with your provider, but at this appointment, the doctor is going to be talking to you about transplant and your eligibility. So he or she will look at your disease, will look at what treatment you have received, if you've received any, and we'll also then start laying out steps that are needed to get you through the transplant process. When you first come to meet the doctor, if you are considered a transplant candidate, then he will bring in one of the nurse coordinators like myself to make an introduction, and you may also even see one of our social workers. After you have undergone your initial treatment, you will then start your pre-transplant evaluation process. During that process, you will be tested and educated on a number of things. So first, we're wanting to educate you on the process. So you're going to have an appointment with me or one of my fellow coordinators. At that appointment, we are going to walk you through the stem cell collection and transplant process. We will have a calendar for you to give you an idea of what's to come, and we'll let you know what's expected for each step of the process. We will also be running a series of tests on you to make sure that your body is physically strong and healthy enough to undergo the stress that can come from this process. So we'll be doing testing on your heart, we'll be checking out your lung function, we'll be doing lab work, we'll be repeating some imaging, and you'll likely have a bone marrow biopsy as well. In addition to all of those appointments, you'll also meet with a social worker who will be there to assist you and determine if there's any barriers to you being able to undergo this transplant safely. So we want to make sure that you've got a caregiver identified for after transplant, that you're not having any transportation or lodging issues. Social workers can help you apply for any grant funding and co-pay assistance programs as well. After you've completed your evaluation process, we will then bring you in to meet with your transplant physician. At that appointment, the physician is going to be reviewing all of the testing that we did prior. We will then be making sure that disease-wise, your disease is controlled and we are in a good spot to move forward. We will also make sure heart, lungs, kidneys, liver, everything is in a good shape as well to proceed with the process. At that consent visit, the doctor is going to want to make sure that you feel comfortable knowing the risks of the procedures and the benefits of the procedures. And at that time, you can ask any questions that you have lingering about the process. You'll be meeting with the physician and the transplant coordinator at that visit, and we'll be talking about the stem cell collection and the stem cell transplant. After you've consented and agreed to move forward with your stem cell collection, you will be using a medication called filgrastim. Filgrastim is actually a belly injection that we can teach you how to give yourself, or a caregiver can administer those injections for you. The purpose of the filgrastim is to try and help trick your body into releasing those stem cells from your bone marrow into your bloodstream so that we can collect them for your transplant. In order for us to be able to get those stem cells out of your bloodstream, we have to place a central line the day before you start your collection. So a central line is needed not only for the stem cell collection part of the process, but you will likely keep that line in throughout your entire transplant stay in the hospital as well. So the day before you collect your stem cells, you'll be coming into Emory, and an interventional radiologist will be doing the procedure where they place the line. So the central line is essentially a heavy-duty IV, but it's essentially 2 lines or 3 lines in one. So the line is going to be placed typically in your chest area, and a doctor is going to be doing that procedure, typically offering some sedation for that procedure as well. But a doctor makes a small incision in your chest and uses imaging to guide the placement of the line under your skin and into a larger vessel near your heart. So by having this line, it can do several things. First, it allows us to be able to tweeze out those stem cells that those belly injections have helped push out of your bone marrow into your bloodstream. We can also use that line for blood draws so that any lab work you need, we can get through that line. When you're in the hospital, we'll use that line to give you chemotherapy. We will give the stem cells back to you through that line, and then any blood transfusions, medications, fluids, we'll be able to use that line to give you whatever you need during that time. This line will likely stay with you from the time of collection and through transplant, and likely be taken out about within the first week after you are discharged from the hospital after transplant. In terms of how your stem cells are collected, we are going to have you do the belly injections for a number of days at home prior to coming in. The day before your scheduled collection day, we have you come in for some pre-collection testing. So essentially, we're doing lab work to see how well your body has responded to those injections, to see if you have enough stem cells in your bloodstream to be able to be put on the machine the next day. If your counts are high, but we need them to be a little bit higher, then you may need an additional medication to help push out more stem cells. Once you start your collection process, you will likely be collecting stem cells for anywhere between 1 and 3 days. And it really depends on the person. Some people can collect in 1 day. Sometimes it can take as long as 3 days to collect the number of stem cells we need for transplant. The stem cells are going to be collected in our hemopheresis unit, and you will be assigned to a hemopheresis nurse on the day that you come for your collection. Your collection is an outpatient procedure, so it means that you will come to the clinic, to the procedure area every day, and you may have to then go home and come back the next day if you need an additional day of collection. Once we have the number of stem cells we need for transplant, there will be a bit of a break between your collection and you admitting for transplant. And the reason for that is we're doing testing on the cells to make sure that we have a good quality of stem cells, a good quantity of stem cells. We are checking to make sure that we don't see any cancer cells in the product, and that it is a good, clean, safe product to give back to you. At that point, once we can ensure that, and we have made sure that you've been consented for your transplant, we will then admit you to the hospital. Plan to be in the hospital for about 2 weeks, roughly 14 to 16 days. On the first day that you are admitted, we are not going to waste any time. We're going to go ahead and give you a one-time dose of the chemotherapy, with the goal of that chemotherapy being to reduce or eradicate any lingering cancer cells that you still have in your bone marrow. So it's a 30-minute dose, it's very fast, and it's given the day that you admit. The second day you're in the hospital, we call it a day of rest. We're just letting that chemotherapy get out of your body. On the third day that you're in the hospital, which you'll hear us refer to as day 0, we are giving your stem cells back to you. Those stem cells are going to be infused through your trifusion, and it takes anywhere between 30 minutes to an hour, so it's a pretty quick process. We know that the chemotherapy we give you, it is going to not only get rid of the cancer cells, but it's really good at getting rid of your good healthy cells as well. So about a week after you've had that chemotherapy, we know that your white blood cell count will drop, and that can put you at risk of infection. We know that your platelets can drop, and that can put you at risk for bleeding issues. We know that your red blood cells can drop, and that can put you at risk for anemias. So during this time, we are wanting to give you antibiotics and do whatever we can to prevent you from picking up any infections. We will also be monitoring your temperature and jumping on anything that may indicate an infection to try to treat it right away. You may need some blood products during this time to help keep your red blood cells and your platelets in a safe range, because we want to make sure that you're not having any complications with that. In addition to watching your blood counts, we also know that you're likely going to have some other side effects. So those may include feeling really, really fatigued. You may feel like you've got some nausea, vomiting, or diarrhea. We know that from day 1, so we've got many protocols that we can implement to try to keep you comfortable and keep you safe during that process. When your counts are really low, it is likely that you will be feeling really, really fatigued. So that doesn't mean that we expect you to be in the bed all day, every day. We actually want you out of the bed during daytime hours as much as possible, and we want you walking around the unit. Our goal is for you to walk roughly 11 laps around the unit every day, which equals a mile. This is going to help you maintain your energy. It's going to help keep your body strong and able to fight off infections better. Also, when you're up walking and you're breathing more deeply, that can help prevent pneumonias, which can potentially become very serious. So we want to keep your activity level up as much as possible. So before even admitting to the hospital for transplant, if you are not able to walk a mile a day, start making plans to get more steps in every day, so that by the time that you admit to the hospital, you're already able to walk a mile, and then you can maintain walking a mile while you're in the hospital. That's going to be helpful in keeping you as safe as possible. So after you've gotten through that, roughly about between 4 to 6 days of your counts being low, eventually your stem cells are going to start growing, and they're going to start dividing, and they're going to start becoming white blood cells, red blood cells, and platelets. If you're not having any other issues that we are needing to troubleshoot, then at that point we're going to start talking about discharging you home or to a local lodging facility. One thing that's really important to remember once you leave the hospital is you are starting over with a brand new immune system. So it's really helpful to think of yourself as almost being a newborn baby. So newborn babies haven't been exposed to all the germs and the viruses in the world. And so with newborns, we do a lot of things to try to prevent them from picking up infections. It's going to be really important that you treat yourself like a newborn baby. So we want to make sure that when you are out and about, you're staying away from crowds, that you are staying away from people who are sick. A lot of elementary, kind of preschool age children who've got a lot of snotty noses. We want you to do whatever you can to keep yourself safe. So frequent hand washing or hand sanitizer is going to be helpful as well. In addition, it's likely that you are going to be discharged and still have that central line. We will typically remove that within that first week after you leave the hospital, once we know that you're not needing any IV fluids or antibiotics or things like that. The first couple of weeks, we're going to bring you back to the clinic a couple of times per week, and that's just going to be for us to be able to lay eyes on you, make sure that we're not seeing any signs of an infection, that you're able to hold down fluids and food, and that you're doing okay. In that first 2-week period, we want you to have a caregiver for 24/7 for 2 weeks. In that time period, as I mentioned, your line is going to be coming out. After transplant, once you've gotten through those first couple of weeks, once the line's out, once we make sure that you are okay to return home, we're going to let you go home and work on just getting your strength and energy back. So we typically give you between 60 and 100 days after transplant to just be at home working on getting your strength back. After those 60 to 100 days, we are going to bring you back to the clinic. We're going to repeat your labs and your bone marrow biopsy and determine what kind of a response you received from the transplant. Based on that information, your transplant provider will then make some sort of a recommendation for maintenance treatment in the outpatient setting. One thing that's really important to know is it is a requirement for all of our patients who undergo transplant to have a designated caregiver or caregivers for those 2 weeks after you leave the hospital from your transplant. So it doesn't have to be one caregiver. It can be one or two who tag team and rotate, but we want to make sure that you've got somebody with you 24/7 for 2 weeks. This caregiver does not have to have any nursing training, but the caregiver needs to be able to help you with things like meal preparation, with transportation to and from wherever you're staying, and here to see our providers. Caregivers can help with all of the medications that we send you home, keeping those organized. And really, worst case scenario, we want a caregiver who can lay eyes on you. If you were showing a sign of an infection, let's say you had a high fever and you couldn't call for help, you've got a caregiver who can either call 911 or call our clinic to get further instructions on what to do. So just to summarize everything that we've talked about, really the purpose of this stem cell transplant is to significantly reduce the number of cancer cells that are in your bone marrow and to prevent the return of your cancer for as long as possible. We know that transplant is not a cure, but it is the best way to get your disease under control and keep it under control for as long as possible. So just know that this process involves several visits to see the doctor, to come for your pre-transplant evaluation testing. It involves having the injections that are needed to help push out those stem cells into your bloodstream. You will need a central line during this process as well so that we can tweeze those stem cells out and give you the chemotherapies and medications and blood transfusions you need. We know that your stem cell collection process could range anywhere between 1 and 3 days. As part of your transplant, you're going to be getting a one-time dose of a chemotherapy, and it's a high-dose chemotherapy. And that chemotherapy plus the transplant, when we return those stem cells to you, is going to require that you be in the hospital for roughly 2 weeks. After the time of leaving the hospital, we know that your immune system is like a newborn baby's, and so therefore we're going to have to slowly introduce you to the world and let your body and your immune system become stronger and more resilient. There are definitely risks and benefits of these procedures, and you will be discussing those with the provider at your consent visits. So we want to make sure that when you are undergoing this process, that the benefits are as high as possible and the risks are as low as possible. When you are here, feel free to bring any questions with you. One thing about these videos is we want you to be able to watch them as often as you need in order to review the material, because there's a lot of education and there's a lot involved with this process. So please feel free to watch these videos as often as you need to. Also, keep your questions written down so that when you come in to meet with the provider or your transplant coordinator, we can go over those questions with you and make sure that they're answered appropriately.
Great, thank you.